Okay, today I'm going to discuss a substance, a nutritional substance that's also available in supplement form. It's called carnosine. Now, the reason I concentrate on that pronunciation is because carnosine is often confused with carnitine. It's called L-carnosine, not L-carnitine. L-carnitine is something else. L-carnitine is an amino acid byproduct that's made in the body from amino acids, and it's also its main primary function is to help short chain fatty acids enter into the mitochondrial portion of cells, where the fatty acids are used in the production of energy or oxidized. So this is a different substance, carnosine. Carnosine was very esoteric. A lot of people never even heard of it until a couple of years ago when a supplement called Beta-alanine came out. That's the significance of carnosine to Beta-alanine is that carnosine basically is in biochemistry parlance, carnosine is known as a dipeptide. In other words, it's two amino acids bonded together to form another substance. The two amino acids that make up carnosine are beta-alanine and histidine. And so the chemical name of carnosine is beta-alanyl L-histidine, and it's naturally found in the brain and muscles. In fact, carnosine is actually one of the main intramuscular buffers of muscle. This is why beta-alanine is sometimes considered a ergogenic aid that helps reduce muscle fatigue during high-intensity training, because a lot of the fatigue that occurs under high-intensity conditions happens because of an increased level of acidity produced in the muscle as a result of what's known as anaerobic metabolism. And if you could buffer or neutralize the acidity that accumulates in muscle, you can actually increase muscular endurance, and that's the purpose of beta-alanine. But beta-alanine is just a precursor for carnosine. It's actually carnosine that's the active ingredient that offers the buffering effect in muscle. Now, the problem with carnosine is that carnosine, when you take it orally, there's an enzyme in the blood that circulates called carnosinase. Carnosinase. And as soon as carnosinase encounters carnosine, it breaks it down. So when you take an oral supplement of carnosine, most of it is gone within 3 to 5 hours. It doesn't. Supposedly it doesn't get into muscle, but more recent studies show that it does. Now the difference is that with beta-alanine is that there is no carnosinase in muscle. So when you take a supplement like beta-alanine, which is the precursor, that's considered the main precursor for carnosine synthesis, because histidine you get in any kind of protein food. Your muscles always have histidine. It's very rare. The only people that might have a problem with histidine are strict vegans who don't consume enough protein. So histidine's never the limiting factor for carnosine synthesis. So the limiting factor is actually beta-alanine. So when you take beta-alanine, it's absorbed into the body. It gets into the muscle. There's an enzyme that converts it in the presence of histidine into carnosine, and that's the intramuscular buffer. Carnosine itself, though, has been shown in some studies to have other possible health benefits besides the effect of beta-alanine. Carnosine, some studies indicate carnosine can be useful for treating depression. It appears to protect nerve cells involved in brain processes involving cognition, learning, and memory. And what it does is it reduces concentrations of a brain neurotransmitter called glutamate. Now, in normal levels, glutamine is actually kind of a brain stimulate that's involved in memory and intelligence. It stimulates certain brain receptors. I don't want to get too technical here, but it has to do with, let's say, concentration and focus. However, in larger amounts, glutamate is very toxic to neurons in the brain. In fact, most of the damage that occurs when a person has a stroke is caused by a sudden massive release of glutamate, which destroys neurons in the brain. So well, as I said, high concentrations of glutamine have been linked to nerve cell malfunction and cell death. And carnosine helps to reduce excess glutamine, and also by doing so, it seems to help, relieve depression, also because it modulates the amount of glutamine in the brain, not too much, not too little. There was a 6-week clinical study in Iran among 52 adults with an average age of 34. All of them had major depression. They were given 400 milligrams of L-carnosine twice daily, along with an antidepressant drug, and it resulted in a greater rate of response and greater remission rate compared to taking the same antidepressant drug with a placebo. So, in other words, the combination of carnosine with this antidepressive drug worked better than the antidepressant drug alone. So there's some indication that carnosine could be useful in the treatment of autism. There was a study among children aged 3 to 12, 13 of whom were taking the anti-seizure medication valproic acid, showed that supplementing with 400 milligrams of carnosine twice daily for 8 weeks improved certain measures of functioning, including behavior, socialization, and ability to understand vocabulary, while those who were given a placebo showed no improvement in any of these outcomes. However, the other studies show that carnosine did not have a comparable effect in treating autism spectrum disorders. Now, one of the really good things about carnosine, the thing that I find most impressive about carnosine, is that it's a pretty potent inhibitor of a process called advanced glycation. Advanced glycation involves the incorporation of sugar into protein structures that kind of messes up the protein structures. These byproducts are called advanced glycation end products, and when they get incorporated into structural proteins like connective tissue, such as tissues in the skin and the joints, they weaken the tissue. There's a theory that a lot of the cause of facial aging is due to an accumulation of advanced glycation end products, which adversely affects the structural proteins in the skin, that would be collagen and elastin. And also in the joints, advanced glycation end products the joints are largely, tendons, that type of thing. They're largely composed of connective tissue. Advanced glycation end products can weaken them also. Now, it turns out that carnosine is kind of a scavenger of, it combines with advanced glycation end products, causes them to be excreted out of the body, and reduces a lot of the damage. Now, as you might imagine, under conditions of poor sugar control like diabetes, you have an increase of advanced glycation end products, or AGEs, as they call AGEs, and that's one of the reasons why having uncontrolled diabetes increases the rate of aging 5 times over normal. So control of advanced glycation end products is especially important for people with blood sugar problems or blood glucose problems like diabetics and people with insulin insensitivity. Also there's some studies showing that one of the complications of diabetes is kidney damage, which could eventually result in kidney failure. It turns out that probably because of its effect on AGEs, carnosine seems to help to protect the kidneys against kidney damage. There was a study of 44 people, average age 42. This is again in Iran. They were taking oral medication to control blood sugar, and they found that by taking 1,000 milligrams of L-carnosine daily for 12 weeks, it reduced levels of fasting blood sugar by 13.1 milligrams. It also reduced triglycerides, which is fat in the blood, compared to a placebo. Now, those in the L-carnosine group also showed a significant reduction in blood levels of carboxymethyl lysine. That is a biomarker for the accumulation of AGEs compared to placebo. Unfortunately, there was no significant improvements in insulin function in this particular thing. Another study in Egypt of children average age 13 with diabetic kidney disease showed that taking 500 milligrams of carnosine twice daily decreased glycated hemoglobin by 0.8% and decreased fasting blood sugar by 21.7 milligrams. which was attributed to the carnosine. Carnosine supplementation seems to help people with heart failure. A study of 50 people, average age 62 in Italy, with heart failure showed that by supplementing with 500 milligrams of carnosine each morning before breakfast, along with standard therapy, modestly increased peak oxygen uptake during exercise. Distance walk during a 6-minute test improved by 59.54 meters for the carnosine group, compared to a reduction of 10.56 meters in a control group who weren't taking carnosine. Now, carnosine can pass through the protective blood-brain barrier, which limits substances from entering into the brain. It's basically to protect the brain. It's a network of blood vessels. If something can't get past the blood-brain barrier, it doesn't get into the brain. Well, carnosine can bypass the blood-brain barrier, and since carnosine also has potent antioxidant actions, it can offer some brain protection. And then some people have characterized carnosine as a brain protective substance. One of the problems of brain degeneration involves excess oxidation, because the brain is largely composed of fat. It has a lot of polyunsaturated fat like DHA, that's one of the omega-3 fatty acids found in fish oil. Unfortunately, DHA and the polyunsaturated fats are highly prone to oxidation, and when that happens, it can be a forerunner of degenerative brain diseases like Alzheimer's and particularly Parkinson's disease. So carnosine is thought to help offer brain protection by lowering oxidation in the brain. There was a study in Kentucky among 231 cognitively healthy adults, age range 23 to 65. It showed that by taking 1 gram of carnosine twice daily for 11 weeks, unfortunately, it did not significantly improve cognitive speed, accuracy, or efficiency compared to placebo, but it did improve cognitive speed in the younger participants. In other words, carnosine worked a little bit better for younger people, improving brain cognition or thinking ability. So I mentioned the advanced glycation. Now, what about comparing? Let's say, is it better to take beta-alanine than carnosine? As I mentioned, the problem with carnosine supplements is this enzyme carnosinase, which is ubiquitous. It's in the blood all the time, and as soon as carnosine encounters it, the carnosinase breaks it back down into beta-alanine and histidine, the constituents of carnosine. So the idea is that by taking beta-alanine, you bypass that carnosinase problem, and you get a better boost in carnosine levels. Now, studies show that supplementing with beta-alanine alone has been shown to significantly boost muscle carnosine levels anywhere from 64 to 80% above baseline. And some people have speculated that beta-alanine might be more beneficial than carnosine as a supplement because beta-alanine is more bioavailable, meaning it's not broken down like carnosine is in the blood. As I said, carnosine is within 2 to 3 hours after ingestion, it's broken down into beta-alanine and histidine. But a study that compared muscle carnosine levels after supplementing with 6.4 grams of beta-alanine, that's about the top of the recommended dose of beta-alanine, or an equivalent amount of carnosine for 4 weeks, found that both supplements increased muscle carnosine with no significant difference between the two. So, in other words, now nobody really knows. Beta-alanine might not be significant. It might not be significantly better than carnosine in increasing muscle carnosine. I've talked about beta-alanine in past videos. I'm not going to get into it here. What about the safety of L-carnosine? Carnosine it doesn't have any safety concerns. There's usually no problems with carnosine. As I said, the biggest problem with carnosine is a lot of it is broken down. I've seen studies showing that if you take a larger dose, for example, 1,000 milligrams of carnosine versus, let's say, 500 milligrams, a lot of the carnosine will be broken down by the carnosinase enzyme, but because of the larger doses, about half of the carnosine does survive. and it can get into the muscle where it will increase the buffering capacity of muscle, which is very good for exercise. As I said, the carnosines can get into the brain. It seems to reduce the aggregation of amyloid B, which is considered one of the main causes of Alzheimer's disease, and it also helps regulate calcium levels in muscle. Calcium is very important for muscle contraction. So because of that, carnosine may improve exercise effectiveness. So I think that's about it for carnosine. I use carnosine. I take it 1,000 milligrams once a day, and I take it mainly because of its anti-glycation properties. I have a little bit of a genetic problem with, I don't have type diabetes, but I tend to have insulin insensitivity. It has to do with a family history of diabetes. So just to play it safe, assuming that maybe my body tends to produce a little bit more advanced glycation end products than normal, I take the carnosine once a day, 1,000 milligrams. And as I say, it's very good for brain function also. The only problem with carnosine as a supplement, it's kind of expensive. An average bottle costs me about $30, but I only take 1,000 milligrams, so it lasts a pretty good amount of time. I think there's about 90 capsules in the bottle. So carnosine, again, it can be made in the body. Beta-alanine is also made in the body. It's produced from the breakdown of certain nucleic acids. So you make beta-alanine in the body, and you also you get histidine from protein food. So what this means is your body makes carnosine, but how much it makes is anybody's guess. I don't really know. I don't think anybody really knows, but it is made in the body, which is why it's not considered an essential nutrient. So that's about it for carnosine. Could be useful. Biggest surprise to me when I did the research for the carnosine was a study showing that carnosine gets into the muscle just as much as beta-alanine. That really threw me because everybody thought that beta-alanine was far superior to carnosine in getting into the muscle, but it turns out carnosine gets in just as much. And I would suspect that you'd have to take about 1,000 milligram dose of carnosine to get that effect. So that's it for carnosine. If you want more information on nutrition, exercise science, anti-aging research, supplement science, which supplements work, which ones don't, ergogenic aids, did I mention hormone therapy, women's health and fitness, effective fat loss techniques. All these topics are covered in my Applied Metabolics publication. I cover more topics in Applied Metabolics than any other digital publication on the internet. No other digital publication can match my over 60 years of experience and knowledge. So this is the place to go. It's all truth, evidence-based. I don't push any products. This is the problem today with the internet, with both videos and publications. A lot of them are influenced by commercial entities, so you're not really getting the whole picture. You will in Applied Metabolics, 100% truth. Also, it's at www.appliedmetabolics.com. When you subscribe, send me an email. I'll send you an invitation to join my private Applied Metabolics Facebook page, where each day I post new information on nutrition, exercise science, and general health and medicine. I have an email portal on my Applied Metabolics webpage where current subscribers only can send me short questions about anything they read in Applied Metabolics or anything that they're curious about related to nutrition and exercise science, and I will answer them in appreciation for their subscription to Applied Metabolics. That offer only applies to current subscribers of Applied Metabolics. I don't answer unsolicited questions. Also, if you think my videos are of any use, please subscribe to this channel. It's completely free. I post a new video every Tuesday. There's no bells and whistles. Just as an anecdote, I was looking at videos the other day on YouTube by a certain doctor. This guy he claims to have 25 million subscribers, and I did some research, and this guy's making a fortune. He has, just like some of these other medical professionals, they get a bunch of sponsors to pay them to push their products, and this guy does the same thing. He's got like 15 different sponsors, and according to some research other people did, this guy makes $39,000 every time he posts a video. But the guy's a clown. I mean, he tries to make his videos entertaining. I find them grating. They annoyed me so much that I got rid of his video. I can't even stand looking at him. I don't even want to know about him because, I mean, he has little cartoons. He has little characters jumping up and down while he's I mean, it's annoying. Or maybe I'm an old crotchety guy. I don't know. But I can't focus on a topic when I have all these distractions. So I got rid of this guy. So with my videos, as you could see, I just give you the 100% plain information. No cartoons, no dancing girls, no cute little cats meowing in the back. None of that stuff. It's because I mean, I think the information is what's important. If you want to get entertained, there's a lot more entertaining things to watch than this guy's videos. But a lot of people, simple-minded people, I guess they love that. And, these are people that never mentally got past the age of 4, so it's like watching cartoons to them. My videos are for more intelligent people that want evidence-based, solid information. So thank you for listening. If you want to have the best friend you'll ever have, go to your local shelter, adopt a dog. Take care.